Today we start with the nose part. Okay, so anatomy and physiology of human nose. Here we will see some important point about the anatomy and physiology of the human nose, and some diagrams, some key diagrams including the anatomic structure, as long as some procedures we will focus on, because they keep on coming in the MCQs, even the procedures. Okay, there are basically three parts of the nose. Number one, external nose. Number two is nasal cavity, and number three is nasal sinus. Okay, so external nose, nasal cavity, and nasal sinus. External nose again is subdivided into bony part and cartilaginous part. So external nose, some part of external nose is bony and rigid, and some part of the external nose is cartilaginous and flexible in nature. Okay, if you touch the front part of your nose, you will find that this is a bit soft in nature, and it's movable. It's not rigid. So that part is made up of cartilage instead of bone. Okay, and the upper part of the nose is made up of bone. Okay, so what are the bones? The bones are again divided into two parts. Number one is nasal bones, and number two is the frontal process of maxilla. So what are the constitutes of the nasal bones? These are nasal bones and frontal process of maxilla. And the cartilage of nose is divided into the superior and inferior nasal cartilage, septal cartilage, and some small cartilages. Okay, so superior and inferior nasal cartilages, septal cartilage, and some small group of cartilages. We will see later in details. Okay, then next we come to the nasal cavity. The extent of external nares to the posterior nasal apertures. Okay, so the range or the area or the region of nasal cavity lies in the area which starts from the external nares or nostrils to the posterior nasal apertures. Okay, so this is the whole portion is known as nasal cavity. Okay, now nasal cavity is divided into left and right halves by the nasal septum. Okay, so nasal cavity is divided into two parts, right half and the left half. Now, which is the separating part? The separating part is the nasal septum. Nasal septum separates or divides the nasal cavity into right and left halves. Okay, each half has a roof, a floor, a medial, and a lateral wall. Okay, measurement is 5 centimeter in height. 5 centimeter means what? 5 centimeter means 2 inches. Okay, 2.5 centimeter makes 1 inch. So 5 centimeter is about 2 inches. Each 5 to 7 centimeter in length. Okay, and 1.5 centimeter wider near the floor, and near the roof it is 1.2 millimeter. Okay, next is the nasal septum. Okay, let's see the diagram. Okay, this is the nasal septum. See this part. This part is the nasal septum, and this one is the beginning or the starting of nasal cavity. It goes on up to the base between the two eyes. Okay, it lies up to the portion between two eyes. Okay, right here. Okay, so nasal cavity means this part to this part, internal part. Okay, this is the external part, and the hollow portion is known as nasal cavity. This nasal cavity is divided into left half and right half by the nasal septum. This is the left part, this is the right part, and this is divided by this nasal septum. Okay. Now see, this is the normal position of nasal septum, and this one is the deviated nasal septum. We will see later the deviated septum as a separate pathological condition. Okay. So this is the nasal cavity, and this is the nasal septum. So nasal septum has divided the nasal cavity into two parts. This is the left part, this is the right part, and this portion is known as nostril or nair, nasal nair, or the hole, this whole part. Now see, the this part of nasal cavity, that means the left part of the nasal cavity, has a floor. This is the floor, this is the roof, this is the medial wall, this is the lateral wall. This is the floor, this is the roof, this is the medial wall, this is the lateral wall. Okay, and again this right part of the nasal cavity, which is separated by this nasal septum, is having again those parts. That means this is the roof, sorry, this is the floor, this is the roof, this is the medial wall, and this is the lateral wall. Okay, so we will see their functions and their composition, how they are formed, the formation of each of these components like roof, floor, etc. We will see them one by one, and these are the nasal hairs. Okay, these are the nasal hairs. What do they do? What functions do they serve? They condition the air. So this term is mentioned, that conditioning of air is done by these nasal hair. Okay, they trap the dust and other particulate matter, and they prevent them from going into the lung or into the bronchial tree. Okay, so conditioning of air and other pathogenic or organisms and particulate matters is done by this nasal hairs. Okay, so let's get back to here. Next is the nasal septum. Nasal septum is osseo-cartilaginous partition. Why it is osseo-cartilaginous? Why it is osseo-cartilaginous? Osseo means this is related with bone, and cartilaginous means this is related with cartilage. So that means the nasal septum is comprised of both an osseous part or a bony part and a cartilaginous part. Okay, covered with mucus. As we have already known that the nasal cavity is filled with mucus. Okay, nasal cavity is filled with mucus. So we take samples. So we take mucus swabs from nasal cavity. Okay, next is the nasal septum lies between the two halves of the nasal cavity, forming the medial wall of both the nasal cavities. So here, this is the nasal septum, this is the nasal septum, this is the nasal septum. Okay, so the nasal septum forms the medial wall of both this left half and this right half. Okay, the lateral half or the outer half are different, but the medial half is composed of this nasal septum only. Okay, for both these halves. Okay, so the nasal septum forms the medial wall of both the nasal cavities. Bony part, bony part of the nasal septum is comprised of vomer. Vomer is the facial bone, and perpendicular plate of ethmoid. So the vomer and the ethmoid sinus, actually the ethmoid bone and vomer bone constitute in the formation of this bony part of the nasal septum. Nasal spine of the frontal bone, the rostrum of the sphenoid, and the nasal crest of nasal and palatine and maxillary bone. So these are the bones, and these are the parts of the bone that are involved in the formation of the bony part of the nasal septum. Okay, so what are these? These are the vomer and perpendicular plates of the ethmoid bone. Okay, Next is nasal spine of the frontal bone and the rostrum of the spine. Rostrum means the hind part. Rostral surface means the hind part. Okay. Next is the nasal crest of nasal, palatine and maxillary bones. They constitute, these structures constitute in the formation of the bony part of the nasal septum. Next is the cartilaginous part. Septal cartilage and the septal process of the inferior nasal cartilage. Okay. So the cartilaginous part is known as the septal cartilage. Okay. So cartilage that makes the septum, nasal septum, and the septal process of the inferior nasal cartilages. So these are the constitutes that take part in the formation of the cartilaginous part of the nasal septum. Okay. So we need to remember this part more importantly, because in the questions it comes like which of the following is not involved in the formation of nasal septum. Okay, so we will have to choose the one which is not there in this list. Okay. Next one is deviated nasal septum. So it sometimes we find a nose like this. So apparently it looks normal, but if we take a closer look and if we examine this part, then we will find that this one is slightly deviated or this one is slightly displaced. Okay, so this is called deviated nasal septum. Deviated nasal septum can result from trauma or any injury, or it can be a developmental error. Like that means it can be congenital, or it can be congenital, or developmental error means it can be a congenital malformation. Though it is a very mild malformation and it does not have any anatomical dysfunction or any physiological dysfunction usually, but if the deviation is more, if the degree of deviation is more, then what will happen? Then it would lead to the restriction of the airway. Okay, so less air would be inhaled and less air would be exhaled, okay, by the nose. Next is racial factors. So different people of different race have different facial structures. So this nasal septum and their position can vary as a racial factor. Next is hereditary factors. So these deviated nasal septum is a part of the inherited trait. So this can be genetic and it can be carried out from generation to generation. Okay, so this is all about deviated nasal septum we should be focused on. Okay. Next one is this is the CT scan of a patient who has deviated nasal septum. As you can see, this is the septum which is deviated, and here the degree of deviation is much more than the previous picture. Okay, so this is the nasal septum which is deviated. Okay, see in this part the airway would be normal, but in this part the airway is compromised. Okay, so less air would be going on. The initial symptoms are like the patient would be snoring during sleep. Okay, the patient will be snoring during sleep and his mouth will be open. Why? To incorporate more air, okay, during sleep. So he will be sleeping and he will be snoring while sleeping, and he will be opening his mouth and he will sleep while his mouth wide open for incorporating air, okay, more air, because this airway would be compromised. And these are what? These are the nasal conchae or turbinates. We will see them later. Okay, these are the sinus. These are the different sinus. This one, this one, this one. These are the sinus. So first of all, we need to identify which type of imaging this is. So this is a CT. How to understand this is a CT? Because here the bones are white. The bones are quite radiantly white or bright white. So this is either bones are white in two structures, either in X-ray or in CT. Okay. So here we can say that this one is a city, because this one is a very detailed structure which is not seen in the X-ray. Okay, these are the teeth. Okay, and in MRI we would see just the opposite. That means the bones will be shady like this one, and the muscles would be visible as well. Okay, so sometimes it is also asked, though it will be, I mean, it is a part of the radiology, but we will discuss it here as well. But the image itself is asked to identify which type of radio imaging is this, whether it is CT, whether it is X-ray, whether it is MRI or what. So we need to be clear about these things. So whenever it is very easy to identify the bony outline of the structure, of the presenting structure. So we will first see that whether the bones are presenting as bright white or not. If the bones are bright white, then we would understand that it is either an X-ray or a CT. Okay, because the main principle of both X-ray and CT are the same. So bones will be shown as bright white or chalky white, either in X-ray or in CT. Okay, so this is how we can identify CT, the type of radiograph. Okay, so next one is type of radio imaging. So this is another picture of this nasal septum deviation. So this is this picture corresponds with this CT image. Okay, this picture corresponds with this CT image. These are the nasal meatuses or nasal turbinates or concha. These are known as concha. So there are 3 pairs of concha or 3 pairs of meatuses. Okay, so these are basically the drainage of different sinuses. Okay, these are the draining outlets of different sinuses. So this is superior meatus or superior concha, middle meatus or middle concha, and inferior meatus or inferior concha. Okay, so these are shown here. This is obviously deviated, but in the normal picture it would be straight. Okay, so we can still identify the different conchas. This is the inferior, this is the middle, and this is the superior. Okay, next one is the lateral wall of the nose. What is the lateral wall of the nose? This is the lateral wall of the nose. Okay, this is the lateral wall of the nose. This one, this part is the lateral wall of the nose. Okay, so the lateral wall of the nose is comprised of turbinates and meatuses. Turbinates are 3 conchas, bony conchas are 3 concha or 3 conchi. Concha is in the singular form and conchi is the plural form. So bony plates covered with mucous membrane, superior, middle and inferior. Meatuses are depression below and lateral to each concha. These are also known as superior, middle and inferior concha. So basically the concha and the meatuses are all the same. So this is the meatus, and concha is just the part of the meatus. Okay, and this portion, this below the concha, below the concha, and this one is the meatus. Okay, this is the concha, this is the meatus. This is the concha, this is the meatus. It's all the same actually. Okay, so this is the concha, this is the meatus. Meatus means the exact aperture. Okay, meatus means the exact aperture or outlet. And concha is the whole structure. Next is roof of the nasal cavity. That means this part, this upper part, which is not visible in this picture. This part, this is the roof. This is the roof of the nasal cavity. Okay. Anterior part is the or it is called the nasal part of the frontal bone and formed of the nasal bone. So anterior part of the roof of the nasal cavity is formed of nasal part of the frontal bone and the nasal bone. Okay, the middle part is formed by the cribriform plate of the ethmoid bone. Okay, so as we have already seen that the nasal bone, in the formation of nasal bone, there is a contribution of ethmoid bone. So the middle part of the middle part of the nasal roof is formed of the cribriform plate of the ethmoid bone. So what is the important point of this cribriform plate? Cribriform plate is a part of the ethmoid bone which is perforated, and whenever there is a fracture of the cribriform plate of the ethmoid bone, then we will be having the classical features of CSF rhinorrhea. That means CSF would be leaking out from the brain and the CSF cavity and it would be leaking out from the nose. Okay, so CSF leakage is seen in the case of cribriform plate fracture. Okay, so we need to remember that. The next is the posterior part. Is the posterior part of the roof of the nasal cavity is formed of the body of the sphenoid bone. Okay, so anterior part is formed by the frontal bone and nasal bone. Middle part is formed by the cribriform plate of the ethmoid bone, and the posterior part of the nasal roof is formed by the sphenoid bone. Next is the nasal sinuses. Okay, so sometimes they are called as the part of the nose, and sometimes they are called as a separate entity as the nasal sinuses. So there are basically 4 groups of sinuses. Number 1 is frontal sinus, number 2 is ethmoid sinus, number 3 is maxillary sinus, and number 4 is sphenoid sinus. Okay, so frontal sinus is 1, ethmoid sinus is divided into anterior and posterior. Maxillary sinus are there in both the side. Bilateral maxillary sinuses are there, and bilateral sphenoid sinuses are also there. Okay, frontal sinus can be divided into 2 halves, like left and right. Okay, both are it's same for all the sinuses, but in case of ethmoid sinus, this is known as anterior and posterior sinuses. Okay, so maxillary sinus is maxillary sinus lies in the body of maxilla, as the name suggests. Maxilla is a facial bone. Frontal sinus lies between the 2 plates of the frontal bone. Sphenoid sinus lies inside the body of the sphenoid bone, and ethmoid sinus lies inside the lateral part of the ethmoid bone. All the sinuses are present at birth except the frontal sinus, which appears during the 2nd year of the life. That means 2 years onwards. So only frontal sinus is absent at birth. Frontal sinus is not present at the time of the birth of the baby. So frontal sinus appears during the 2nd year of the life. So this one is very important. We need to remember this. Okay. So here we will see the different sinuses in this diagram. So this is the frontal sinus. Okay, this is the frontal sinus. In general, what happens is that this whole portion is known as frontal sinus, and these two are talked about. These two are called as the 2 parts of the frontal sinus, and in some cases, in some books they call like this is the left frontal sinus and this is the right frontal sinus. Okay, and this is the middle. This is the frontal sinus. This is the maxillary sinus. Okay, this is the maxillary sinus. Okay, this is the ethmoidal sinus, and this is the sphenoidal sinus. Okay, so this is the frontal sinus, this is in both the halves. This is the maxillary sinus. This is the maxillary sinus. Okay, this is the sphenoidal sinus here, and this is the ethmoidal sinus. Okay, this is the ethmoidal sinus. So here also we can appreciate the different sinuses, like this portion, as I mentioned that in this CT we would not recognize the two frontal sinuses differently, but we would say like this is the frontal sinus. Okay, this is the frontal sinus, these are the maxillary sinus, this one and this one. This is the ethmoidal sinus, this one, this one and this one. This is the ethmoidal sinus, these are the ethmoidal sinus, and these are the sphenoidal sinus. These are the places of eyeball, or these are the orbits. Okay, orbits where the eyeballs are fixed, like in the sockets. These are the sockets where the eyeballs are plugged into. Okay, so these are the different sinuses, and these are again the meatuses. Okay, these are the meatuses and conchus. This is the nasal septum. This is the nasal septum. See, this is straight, and each of the two nasal cavities are almost equal. Okay, and this is the other view of this different sinuses. The nasal cavity can be appreciated well here, and these are the orbits. This is the orbits. This is the frontal sinus. Only the frontal sinus is properly visible in this picture. Okay, and this, yeah, these are the sphenoidal sinus. These are the ethmoidal sinus. The maxillary sinus cannot be appreciated from this radiological imaging. Okay, so for sinusitis, for diagnosis of sinusitis, we need to take different views of the CT. Okay. Next is maxillary sinus. So in this radiograph, or in this CT scan view, we can appreciate the maxillary sinus well. So this is the maxillary sinus. This one and this one. This one and this one. This is these are the frontal sinus. See, this is an enhanced CT, and here we can actually very precisely we can see the two halves of this frontal sinus. This is the left half, this is the right half. Okay, this is the nasal septum. The nasal septum is, see, this part of the nasal septum, this is very interesting. This part of the nasal septum is bright white. This part of the nasal septum is a bit hazy, because this part of the nasal septum is osseous part, or the bony part, and this part is the cartilaginous part. That is why there is difference in the radio opacity. This one is more radio opaque, this one is more radio lucent, or the radio opacity is less. Okay. Next is ethmoidal sinus. These are the ethmoidal sinus. Ethmoidal sinus is above the sphenoidal sinus. Okay, this one is ethmoidal sinus. This is the maxillary sinus. These are the sphenoidal sinus. These are different views of different sinuses, the different views to have a closer look on the different sinuses and the related pathologies. Okay, so this is all about the anatomy of the nose.